Hello and welcome to Bytes of Health, where we hope to take a bite out of your parent worries each day with sound advice and guidance. Every morning, we'll answer a commonly asked pediatric question in 5 minutes or less. I'm Dr. Jess Steier, a public health scientist, and today I'm joined by our amazing pediatrician bestie, Dr. Dina DiMaggio. Hello, Dina.
Hello.
So today we are going to talk teeth and dental health. The clock is ticking, so let's get to it. Dina, I remember when my son, who's, by the way, it is his 7th birthday today, and I'm having a moment about it, but I remember when his first little baby tooth came in. So let's talk about the timing of things. When do babies typically get their first tooth?
Great question. So we often get calls around the 3-month mark from parents thinking that their babies are teething, but actually at 3 months, babies just start putting their hands in their mouth and find that they have hands and start drooling more. So often we don't see teeth until a little bit later. So most babies will develop teeth between 6 and 12 months. However, there's a wide range of variability when a first tooth appears. So some babies may not have any teeth by their first birthday, so don't worry about it if you don't see your first tooth until then. But I've seen some babies develop teeth at 4 months, and I've seen some babies that are even born with a tooth. And those babies have to see the dentist right away because we don't want them choking on their tooth if they fall out, but it can be a wide range.
All right, so now I'm picturing those little baby toothbrushes, the ones that you put on your finger. So when should we start brushing our kids' teeth? And I remember I got on my registry, my baby registry for my son. People got me those cute little toothbrushes that you stick on your finger and you kind of just rub their teeth. It's the cutest thing ever. When do we start brushing our baby's teeth?
I love that little thing. Yeah. So once your child has a tooth, you start brushing them twice a day with a smear of fluoride toothpaste the size of a grain of rice, especially after the last drink of food of the day, because you don't want to brush your teeth and then, follow that with 3 glasses of milk because it defeats the purpose of it. And let me repeat, it should be with fluoride toothpaste because I still see in the stores and parents still buying non-fluoride toothpaste. And I really do want parents to use the fluoride version because I have seen in the office kids with a lot of decreased cavities from using the fluoride toothpaste. And we used to see all the time kids going under anesthesia to take about a bunch of cavities. And I've seen that really lessened over the years with the recommendation of the use of the fluoride toothpaste. Once your child turns 3, the American Academy of Pediatrics then recommends a pea-sized amount of fluoride toothpaste to be used while brushing. And when your child is able to, teach them to spit out the excess toothpaste. It is best if you put the toothpaste on the toothbrush until your child is about 6 years old, and parents should monitor and assist their child while brushing their teeth until around 7 or 8. So when your child can write their name well, he or she also has the ability to brush well, which is a good rule of thumb.
All right, what about fluoride varnishes? What do you think about those?
I agree with them too. So during the regular well-child visits, your pediatrician will check your baby's teeth and gums to ensure that they're healthy and talk to you about how to keep them that way. And the AAP and the American Dental Association recommends that children receive fluoride varnish once they have teeth. If your child doesn't have a dentist yet, you can also ask your pediatrician if they can apply the fluoride varnish to your baby's teeth, which often can be done in the pediatrician's office. And once your child has a dentist, the varnish can be applied in the dental office.
So Dina, just one thing is that we often see that people are nervous about fluorosis when it comes to fluoride. As far as I understand, that's when you get those little white or brown speckles on teeth. It's caused by overexposure to fluoride. It's not all that common, and it's actually not harmful. It's just a cosmetic issue, right?
Yeah, I'm never worried about that. I've never seen an issue with that. I've more so seen kids that are not using fluoride toothpaste that have multiple cavities in them, are in pain and have to undergo anesthesia to get those removed. And that's much more of a dangerous situation to me than those spots.
So when should we make our first dental appointment for our child?
That's a great question. So you want to try to make your baby's first dental appointment after the eruption of the first tooth and by his or her first birthday. And I always recommend that. Still, a lot of old school, pediatricians recommend to do it at 3 years old, which I do not believe in. And the AAP and the American Pediatric Dental Association recommends that all children see a pediatric dentist and establish a dental home by age 1. So it's good to have because the pediatric dentist will make sure all the teeth are developing normally and that there is no dental problems, and they'll give you further advice on proper hygiene. And I often recommend by 1, 2 is because in the office, what I see is that toddlers are often trying to hurt themselves, and they often succeed. And if a child falls and a tooth comes flying out or is bleeding, you want to have a dental home to go to. So you want to have that pediatric dentist, already established for those reasons too.
All right. Well, I learned something. We hope you learned something, and we have lots more to share. You can get your Bite of Health every day, Monday through Friday. If you like what you've heard here, let us know. Leave us a review on Apple and be sure to tell your friends. Remember, there is no single or best way to parent. Parenting is a journey, and we are all just doing our very best. We wish you happy, healthy, and stress-free parenting.